I'm Dr. David Broadway. My office is in Lone Tree, Colorado. I've been using Sientra implants for about 11 years now. About 2 years ago, we were able to start using shaped implants, and the shaped implants gave us a whole new dimension, a new way that we could offer customized results to patients that we hadn't been able to do before. The primary benefit for them, I think, is control. Control of superior fullness, the overall shape of the breast. It's really about giving a much more natural result than you can get with a smooth, round implant. I've been using them a long time and I've been very happy with the implants themselves.
I love working with Dr. Broadway today. He's been so open and explaining everything and just trying to pass on what he's learned through over 10 years of experience.
I was very lucky to be invited to go to Stockholm, Sweden and train with Charles Randquist. He's one of the premier plastic surgeons in Europe and has a long history of being able to use shaped implants which were not available to us here in the U.S. So using some of the techniques that I learned there, I was able to bring those back to the United States.
It makes me very excited to start using some of the techniques that he's shown us here in this training program.
I'd like to be able to take really well-trained surgeons and show them some of the shortcuts to being able to get good results. And if I can help them move along much more quickly, that's one of my goals.
You're able to actually see the anatomy, watch how he applies the principles from his lectures in the operating room, and that's been an invaluable experience.
I don't want them to have to reinvent the wheel. I don't want them to have to make the mistakes that a novice surgeon for these implants can create.
It was just a nice exchange of information. It's wonderful to get together with other surgeons and discuss your techniques and, pearls of wisdom, pitfalls, things that you've done.
I think that what I brought to the table this weekend was that looking at minor asymmetries and minor details in the patient's preoperative anatomy and how you can adjust that.
He's sharing, pearls and tidbits that none of us have.
You can see that he really cares about what he's doing and also that he loves what he does.
When they do leave, I'm sure they'll be able to do a great job. It'll prevent them from making some of the mistakes that I made and others have made along the way. I will have been pleased to participate in the care that they're going to offer their patients.